Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. This session is about dealing with patient after adverse event and open disclosure. Objectives of this session: first, we perform patient-centered intervention following an incident, define the term open disclosure, discuss the importance of open disclosure, implement steps for successful disclosure. What to do to the patient after an incident? This generally depends on at what time and at what stage did we discover the incident. Generally, like if there is infusion going on, wrong blood product or wrong dose of medication, the first step is to stop that, so that we avoid further exposure to this wrong intervention. But if the intervention already done or the medication is already given, then it will be to assess the patient and manage accordingly. First, you assess, do general assessment and assess the vital sign and level of consciousness, and also you manage any immediate threats. For example, if the patient receives a high dose of insulin, then you need to monitor blood sugar, and if he is having hypoglycemia, you have to give corrective doses of glucose. So based on this assessment, you will highlight the management plan and monitoring strategy. After you take care of the patient, definitely you have to do an immediate brief disclosure. At this moment, you don't have many details, so you need to tell the patient if what went wrong and how are you going to manage and to address his situation, and at the same time we have to apologize about the situation without pointing finger into any individual. Then we document all this in the patient medical record, and we should fill incident report. And if there is a risk management department, they should come and collect whatever, like fluids, injection, syringe, or empty bags, or whatever. And after that, then people, they do detailed assessment and investigation, and a detailed disclosure will follow and associated with a sincere apology. And during this process, we shouldn't overlook the second victim, the guy or the nurse or the doctor who did the incident. Usually he suffer from trauma, because many of these errors are due to system factor. So addressing that person and counsel him, and we all together learn from this incident. Open disclosure, the process of providing an open, consistent approach to communicating with the patient and their family following bad outcome or an incident. It should be honest, which is an ethical obligation. This includes expressing regret about the whole situation, keeping the patient and his family informed about what happened, and give them feedback about the steps taken to take care of him and the result of investigation, and also steps taken to prevent similar incident in the future. And it is different from counseling. Counseling, it's about discussing bad outcome expected from an intervention or a medication. Open disclosure, it is not about shaming and blaming. Patient perspective regarding open disclosure. Vincent et al. Studied the patient and family perception following an injury, especially those who go for a legal action. He found that over 70% of the respondents had been seriously affected by the incident and caused them to sue. In his survey, this event led to emotional distress which persisted for a long time. Decision to take legal action was based on original injury and was influenced by insensitive handling and poor communication after the event. When explanations were given, less than 15% were considered satisfactory. He concluded that the main reason for litigation were concerned with the standard of care, patient and family. They want to prevent similar incident in the future, and also they need an explanation. They need to know what happened, and they need, some of them, they need compensation for actual losses like pain and suffering, or to provide future care, and the most important, accountability of the individual and institute. So patients want greater honesty and appreciation of the severity of trauma they had suffered, and assurance that there is a lesson learned and preventive measures were implemented. Common barriers to honesty with the patient after an adverse event. Healthcare provider may want to provide accurate and timely information to the patient about an adverse event, but sometimes they fear of legal action, and also they are afraid of the confrontation with angry patient and family member, and they are afraid to provoke distress to the patient, and some of them, they fear loss of reputation and loss of insurance. Disclosure, it is not about accepting blame, it's about integrity and being truly professional, and this can be mitigated by good education and training of healthcare team. There are many protocols for open disclosure. In Harvard model, the first step is preparation, the second, initiation of conversation, then presenting the fact, followed by active listening to the patient and family concerned, acknowledge what has been said, then you conclude the conversation and document everything in the chart. The first step is preparation, and in this phase we have to review patient medical record, we have to listen to the story from the people who were involved, and we need to know who was involved and what are the situation and any environmental factor at that time. And also we have to select who should be involved in the disclosure. For major incident, you need to get hospital administration involved. Generally, a senior clinician should be involved in the disclosure. The second step is to initiate the conversation, and during this phase we assess the patient and family readiness for discussion, and we assess their literacy, what do they know about their disease and about the intervention. The third step, the health professional leading the discussion should give the fact, tell the patient and family what happened without pointing finger, without shaming and blaming, and what are the consequences and expected complication or side effects, and how they're gonna manage and monitor the patient. The healthcare provider leading the discussion should be careful about his non-verbal and body language. After giving the fact, then you promise that investigation and analysis will be done, and patient and family will be updated accordingly. During the process of initiating the conversation and giving the fact, it is very important to practice active listening, acknowledging what has been said. It's important for the healthcare professional to listen carefully and respectfully to the patient and the family member, and it is very necessary and very important to acknowledge family suffering with empathy. At the end, at the conclusion of the conversation, we give them summary, and any unanswered question, we will promise to look for appropriate answer, and we promise to have assessment, analysis, investigation, and then we will update them accordingly. Finally, everything should be documented in medical record and appropriate hospital record. In open disclosure, we are dealing with intense emotion. It's important to note there is a strong emotional context to adverse event. Patients are often frightened and may feel vulnerable, angry, or frustrated. So we need to have the skills in dealing with intense emotion, and this is discussed in another session. One of the tools used for open disclosure is the SPIKE protocol. This protocol is used for breaking bad news. It goes through steps: setting, perception, information, knowledge, empathy, strategy, and summary. In setting the stage, privacy is very important. Privacy is an integral part of medical profession. It is observed all the time. And whenever you are breaking bad news or disclosing, it is also important to observe privacy. Sometimes it is challenging to do that, especially when you have an open ward or in the emergency room or open ICU. In office, that can be accommodated easily. So do your maximum effort to maintain patient privacy. And during this phase, if there is a loud television or radio, you can ask the patient gently to lower them down so that people can listen and hear each other. Also, during the setting stage, you can allow the patient to involve significant others. If the especially elderly or frail, sometimes they need some family member to be with them or a friend, and this should be welcome. Sitting down is very good, and it gives the patient the feeling that you are not rushing, and people usually and the patient appreciate this when the doctor sit down. Listening carefully and to the verbal and non-verbal cues, this can give you a lot of information and you will learn more about the patient. The second step in the SPIKE protocol is perception. It is helpful to ask the patient what he or she is thinking about what is going on. This can help the healthcare provider to understand where the patient is in relation to the understanding of their situation. It tells you where do they stand and what do they expect. Step 3 is to give information. How much information should we disclose? It varies from patient to patient and from country to country, and sometimes it affected by the patient condition. The patient is the main person we need to concentrate on. So we need to concentrate on each patient and to find out what they want to know and how well they are informed and how much they can handling. Avoid assumptions that the patient doesn't want to know. Whenever there is a potential or significant harm, even tiny risk, we should explain and disclose to the patient. During giving information, avoid too much information at once. It might be confusing to the patient. It might lead to information overload. Information should be carefully paced and appropriate for the patient situation and needs. Some patients may not want to have information or participate in decision making. However, discussion, explanation, and answering questions are still necessary to maintain respect of autonomy. Some patients might have difficult questions, but these can be discussed with the senior or with the appropriate specialty. Effective communicators will always foreshadow to the patient that they will be coming some disturbing information. This gives the patient time to prepare, even if it is few moments. For example, Mr. Smith, unfortunately, I have some bad news. The fifth step is dealing with emotion, which is empathy. We have to recognize emotion, to identify emotion, and to deal with these emotions. Listen for and identify the patient emotions. If you are not sure about the emotion being expressed or experienced, ask questions such as, how does that make you feel? Then identify the source of the information of the emotion. It could be related to this bad news or because of this disclosure. You tell them that it is difficult news, and you ask them, do you want to talk about this now? Or if you want me to come back, if you want me to facilitate any discussion with someone else. Many times, the patient will feel good if just you recognize this emotion. Show the patient that you recognize their emotion. It is sometimes very comforting to them. And sometimes if just you remain quiet, you give them time to vent and to show this emotion, it is very healing to them. The final step is strategy and summary. It is always a good idea to summarize the information discussed at the end of the consultation. Patient might ask additional question or remember something important, and whenever this is coming up, you can schedule another in a meeting. It is a dynamic process. It has to be done multiple times. Promoting patients' involvement in their care. Patients who play active role in the management of chronic health conditions seems to enjoy better outcome than patients who play more passive role in their care. Patients and their family can be made aware of opportunities to engage in the prevention of adverse events through awareness raising activity and education about risk of preventable harm. They should be encouraged to speak up to provider about safety concerns. Take home, immediate patient assessment and management should be implemented immediately following any incident. Open disclosure is an essential communication tool following an incident. Open disclosure is an ethical obligation. Utilizing protocol can help in the process of open disclosure. Avoid shaming and blaming, and don't forget the second victim. Thank you and see you in the next session.